Hello everyone, my name is Elena and this is a breathwork practice that I think every hypermobile person should learn so you have a better connection with your breath, a better understanding of the movement it creates within your body. And with that, we will get started. You can do this breathwork practice on the ground in a chair or reclined on your back, whichever is going to be the most comfortable for you. And if you are hypermobile and you are sitting, I will recommend if you have cushions, pillows, blocks, anything, you want to place them underneath your knees just so you're not overextending it in the hip joint. If you would like to try something a little bit more active to strengthen the muscles around the hips, you can also make sure that you are pulling the knees up, kind of like you're trying to close a book, and holding that so that you're not dumping weight into your joints, you're not overextending. And next we are going to talk about the anatomy of the breath. So when we inhale through the nose, I don't know why I used to think this, but I always thought it went like up towards your eyes before going down, but it just goes back along the length of your face. So we have our sinuses, and we have everything that's coming back here, and then it moves down into the lungs. The diaphragm, which is the muscle that connects to the sternum underneath the rib cage and separates the chest cavity from the abdominal cavity. It contracts, the muscle engage, and it expands downwards into the belly. The pelvic floor also moves downwards a little bit with it. The intercostal muscles in between the ribs also expand. So we have this kind of 3D breath. It's not just that our belly is moving out, but our ribs expand. And then on our exhale, it actually takes no effort for the body to exhale because the chest cavity is a vacuum, and we have to engage muscles to draw air in. So there's no effort on the exhale. The diaphragm comes back up. Those intercostal muscles go back to their starting position. And yeah, that's a little bit about the anatomy of the breath. And we're going to take some time to ground into the body, just so we feel like we have a little bit more connection before going into this 3-part breath that I will be guiding you through. And this is Mr. He thinks it's dinner time, and it is not. So he's probably going to be here in the video with us the rest of the time. So we are going to bring the shoulders up towards the ears and then pull them back and away. Up towards the ears, back and away. Now we're going to pair breath. Inhale, coming up. Exhale, coming down. Inhale to come up. Exhale to go down. Last time, inhale up. Exhale down. Sending your weight over to the left sit bone, over to the right. We're just going to rock back and forth. Sorry, I have a hair. Rock back and forth a little bit. Feeling your breath on the inhale and on the exhale. Then we're going to take our hands. Sorry, I think I have a cat hair stuck in my chapstick. And here is Tia. The thumbs are going to be placed on the back. Your fingers are going to wrap around the front of the ribs. So we're just holding the rib cage. And we're also going to connect to the sit bones. We're going to try to tuck that tailbone underneath you, grow tall through the crown of the head. And then notice if you're leaning forward over your knees, we're just going to try to stack shoulders over hips. Tuck the chin a little tall through the crown of the head, bringing those knees up. Exhale all the air out of the body. Breathe in through the nose. Feel the ribs expand into the hands. And exhale. In through the nose. Feeling that 3D breath. And exhale. In through the nose. Exhale. In through the nose. Try to keep those shoulders pulled down away from the ears. Exhale, push the belly button in. Inhale. Exhale. Bring those hands back to the knees. We'll take some more shoulder rolls. Pairing breath and movement. Inhale to come up. Exhale to come down. She also thinks it's dinner time, but it's more serious with her. Go lay down, please. Perfect spot. Shoulders up and down. Up and down. Wiggle it out. And I really hope that that is not too loud on the microphone. So we're now going to move into our 3-part breath, and we're going to add a visualization in just to make this practice a little easier. So imagining that the torso is a water jug. The breath is the water. So as we inhale, that the water fills first the belly, and then the ribs, and then the chest. So we expand first in the belly, then we move to the ribs, and then the chest. And then on your exhale, it's like we're pulling a plug out of the bottom of the jug, and that water drains first from the chest, and then the ribs, and then the belly. So when we inhale, it's belly, ribs, chest. Exhale, chest, ribs, belly. That is our 3-part breath, and we're going to take a few rounds of that, and I'll guide you through it. So again, we're just going to settle. We're going to wiggle a little bit, really feel into the body, feel the breath. Take 2 rounds of breath at your own pace. Tuck the tailbone underneath. Tall through the crown of the head. Go lay down, please. Tuck the tailbone, tall through the crown of the head. Exhale all the air out. Inhale to fill the belly, the ribs, and the chest. And exhale from the chest, the ribs, and the belly. Inhale to fill the belly, the ribs, and the chest. Exhale from the chest, the ribs, and the belly. Inhale to the belly, ribs, chest. Exhale, chest, ribs, belly. Inhale. Continuing with those 3 parts. Exhale. Inhale. Exhale. Inhale, fill the belly, ribs, chest. Exhale. Inhale. Exhale from the chest, the ribs, and the belly. Inhale, fill the belly. Feel the expansion in the ribs. Feel that sternum lift, shoulders go a little further out. Exhale, feel the chest move back in, the ribs come in, and the belly. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Now hold at the top of your breath. And open mouth, sigh it out. We're going to take that breath one more time in through the nose. Hold at the top. Sigh it out. Wiggle in the shoulders. Wiggle in the sit bones. Open the eyes if they've closed. Take a moment to check in with your body. Check in with how that breath felt for you. Do you feel like you were able to connect to each part of your torso a little bit more? Send some gratitude to your breath, to your body for this practice today. Thank you so much for being here. If this was helpful, I would love to hear from you. If you have any questions, please leave them in the comments. And please subscribe, like to the video if this was helpful for you. I plan to post every other Tuesday, and I will remember to feed these guys beforehand. I hope they weren't distracting. But again, thank you so much for being here. Please, I'd love to connect with you. Have a wonderful rest of your night.